Thank you, Dr. Burrell. So our last speaker before the break is Dr. Jorge Delva, PhD, who is the Dean of the Boston University School of Social Work. And we're very happy to have him because he comes from the Charles River campus and is one of our partners. Thank you. Excellent.
Good morning. Thank you for having me here. It's a pleasure, and especially representing Charles River campus, actually School of Social Work. Actually, just myself, really. I'm not the green one? The big green one. Okay. Thank you. So you were talking about the 35,000-foot picture. I'm taking the slightly higher perspective. And I want to, the reason I decided to take this approach, I was struggling about a week ago, actually, what did I want to focus on this talk? And thanks to my teenager, who is a 17-year-old senior and an ice skater, who actually, I'm very proud, represented the USA last year in an international competition. And I highlight that not to brag, and to brag. I highlight that because this is a group of young women who are student athletes. They are excellent students. They train 15, 20 hours a week, something that actually I don't really approve of, but that's their lives. They study, they sign pledges not to use substances. And my family's still in Michigan. I just recently moved. I haven't moved yet. I was visiting Ann Arbor, and my daughter says, you know, Dad, I don't know what's going on. A lot of my friends are stressed out. And I'm like, what do you mean? And I'm thinking, okay, the Syrian war, the Korean Peninsula, you know, what's going on? She's like, oh, I don't know. And she starts naming friends. And then it's like everything, the shootings, everybody's vaporing, she tells me. She says, you go to the bathroom and there they are, and before class, after class. And it was, as she was talking, I thought, there's my topic, because as a social worker and seeing my kids talk about what the both speakers said earlier about the social determinants of health and about context and conditions, and I didn't know how to ground it. And thanks to my daughter saying, we're just, as young people, we're just going through a lot. And this is the privileged kids. These are the kids, these are the skaters and the trainers, and they have nutrition coaches, and they have all sort of coaches, and parents who drive them around, parents who fly them around. And they're feeling this sort of world pressure in them. And I'm thinking, imagine the communities that are disadvantaged, that are vulnerable. What kind of pressure are they living in, those who live in rural areas or urban areas? So thanks to my daughter, who drives me crazy, I thank her for helping me come up with an idea for this presentation. So I wanted to start with a nation in pain. And I know there's a lot of criticism about that we talk of pain this way thanks to the pharmaceutical industry. But even if there was no pharmaceutical industry, I think there's a lot of pain going on worldwide, and these are examples in the United States among adults. Mental illness. I know there are some people who say the estimates were underestimating the percent of people who are experiencing some type of mental illness. Others are saying we way are overestimating. We're a country where we say, ouch, okay, you're mentally ill, you have these problems compared to other countries. I don't know who's right, but I do know there's a lot of pain, there's a lot of stress. There's a lot of weight on our shoulders that we're carrying. And if you add that, and once again, if you add that families who are suffering from unemployment, people who don't have insurance, just the idea of getting up in the day, I just can't fathom what that feels like, what that looks like. And so these are statistics that I think, from my perspective, highlight a level of, I don't really know what to call it. Children and teens, and we know there's a high percent of suicide is the third leading cause of death in youth. So youth, these are the ones the ones that aren't they supposed to have any fears? Aren't they supposed to be thinking about the future? And suicide is one of the leading causes. mental illness. Oh, and another part of the story that was my daughter was telling me that was very interesting is several of her friends have begun therapy and taken medications because they're depressed, they're anxious. And I thought, wow, I've known these children since they were kids, their play dates, and these were happy kids. What is going on? And then I'm thinking, is my daughter vaping? Is my daughter doing something? We're not having that conversation yet. Okay, altering one's consciousness and reducing pain. So I was thinking about the supply side. So we do have the pharmaceutical companies. We do have the overprescribing. We do have diversion. I don't know how many times when we've had to go to the doctor or dentist and we come home with these boxes of pills or prescriptions, and we're a family where if we take something, we just react really negatively. We just, I don't want to be we're going to be eating pretty soon. And so we don't take these things, or maybe once, and then we feel really sick and we just rather take regular Tylenol or nothing. And while we were talking earlier with some of my colleagues that you go home with these large amounts of pills and maybe you need one or none. So we dispense them. Dispense them properly. We don't make extra money so we can take our kids skating to Sweden. But others don't. And so this is definitely part of the supply problem. And then, of course, we've heard those pill mills and drug traffickers. It's definitely part of the, and then health insurance policies. They understand that one is more likely to be covered if you're prescribed drugs than if you might be assisted with some other type of intervention that could actually lead to health. But I kept thinking, again, my daughter's voice was in my head. What else might influence our desire to alter one's consciousness and to seek relief from the pain we experience? Because we do these things to feel better. We don't do these things to, I'm just going to feel like, and I'm going to take all this stuff so I can feel like, blurb. I'm going to do these things because I'm just not feeling good and I need to feel better. I need to seek relief from something. That's why we do these things, and unfortunately we overdo it, and all sort of problems happen, and this place is full of professionals trying to prevent that and help people who do that. So I wanted to talk about society's welfare, again, as a social worker, and well-being, not just health. And interesting, as I was preparing for this talk, I thought, focusing on social welfare, there's so many connotations about that word. We think about the impoverished, we think about means-tested policies. And then I ran into some readings that I hadn't run, thanks to this presentation. You know how we always learn something thanks to having to prepare for something. And there's I learned, and many of you probably know this, that within the world of medicine and public health, there is a conversation going on about well-being. Why are we focusing not just on health or social determinants of health, which is excellent, but why aren't we focusing on well-being? And I found that very interesting. Now, within that, of course, you've heard about the county health rankings that talks about that research shows that most of health is impacted by socioeconomic status and health behaviors, and of course clinical care is critical. My kid's riding a bike, breaks a leg, I want that help, I want that expertise. But if my kid is riding a bike that we can't afford a helmet, in neighborhoods where traffic doesn't permit it, where we don't have access to parks to ride a bike, where there might be drive-by shootings, and I could go on and on and on, suddenly that broken leg, as Dr. Galea was describing, is the situation that led me to the doctor, but there's all these circumstances that created an environment, a context towards that broken leg, or my ability to help. I have insurance, I have a good job, others don't, to help my kids. So some of these insights I've acquired over time. I worked as an additions counselor with Native Hawaiians in Honolulu many years ago, and I worked with CTSI in Michigan and with populations in Flint and Detroit, and working with all these diverse populations and in, again, very challenging contexts. In each one of those African Americans, American Indian populations, Native Hawaiians have had different traumatic histories in this country. And they've taught me about when people are seeking relief from pain and pursuing well-being, culture matters. And having culturally available, accessible, and adequate prevention treatment services matter. So we know services matter, but knowing how to provide that in a way that is more receptive and welcoming matters tremendously to these communities. And of course, that has been covered earlier. I'm thankful to the earlier speakers, because I feel that I can build on what they were talking about. And of course, legal socioeconomic context matter. And again, you saw my first picture of the universe. I'm way, way, way up there. So continue now the demand side. So that was more on the earlier on the supply side. The demand side. So it's this worldwide threat. Again, I'm going back to the voice of my 17-year-old. Despite all these gains, we live in Ann Arbor. We live in a nice street. Kids can bike. It's comfortable. Potholes are covered. But we live in a time, I think, of extraordinary economic, social, political, and climate uncertainty and soaring inequalities. How could that not affect people? Unparalleled geopolitical crisis. Although it was nice to see recently the picture of the two North Korean leaders holding hands. I wanted them to hug and kiss. That's what would have been the proof to me that we're going to denuclearize the region. But they haven't made out yet. So, but there's progress. Large population displacements. We hear this in the news internationally and nationally, the conversation about all the undocumented immigrants, the need to build walls, the need to arrest and deport millions of people. Where one falls, independent where one falls on the spectrum of the political spectrum, either way, you're totally stressed out. One, you're stressed out about these very mean people that you need to round up and take them away, and you're angry about it, or you're stressed out that that might happen. And so the stress level is just incredible. And then, of course, there's increased intolerance, injustice, discrimination, and I appreciated what the term Dr. Galea used earlier that I hadn't heard that about economists talking about the bucket of diseases of despair. If I wrote it correctly, buckets of despair. I think it's very large buckets of despair. It's swimming pools of despair. So these are the messages. So my daughter was like, "Well, I don't know that. It just feels heavy, the environment, and I see my friends just having a hard time coping, and I don't know how I'm feeling." And I'm thinking, well, who wouldn't if this is what's going on? And they're bombarded in television and social media, and parents who have these conversations at home are not being very helpful about it. We're trying to create some context for understanding. And then the more social worky part of me is the erosion of the social safety net in the U.S., increased job insecurity, decreased health coverage, decreased support for unemployment compensation, decreased support to aid to dependent children. There's hunger and food insecurity in this country. It's unbelievable to think that we have that. Ongoing attacks on Medicare, Medicaid, supplemental security. I mean, it's like constant. Even when we had a more supportive administration, the narrative was still so toxic, and I'm thinking, so I'm a worker that I don't know if I'm going to have a job tomorrow. I could be working in an environment where I could chop my hand out if I make a mistake, and then I don't have coverage, or it will be very short. I'll take those pills, and I'll take lots of those pills. Relentless attempt to undermine the Patient Protection and Affordable Care Act. Again, this attack on compassion, this attack on decency, and it's not just this past year. I think it's something that's been building for a while. Decreased support to educational programs. Again, I'm taking the social welfare in a very large perspective in terms of fund that can provide our kids with a more secure environment, a learning environment, to create hope, to create a positive, optimistic view of the future. Head Start, again, fortunately, due to bipartisan support, the funding increased by $600 million compared to prior years, but the narrative was again, okay, well, only some children deserve it, not others' children. And then the statistic that shows there's an increase among Hispanics in the percent of use and impact in Hispanic, 101%. Well, could, and I don't know, this is not a scientific study, I'm just thinking, could living in an environment that being Hispanic, documented or undocumented, it's a threat just by being that. Could that be, in addition to all the other socioeconomic factors, could that be contributing to some of those increases? And then mistrust of our institutions, gun violence, that's very heavy on people's minds, on young people's minds. My daughter says, Dad, there was another shooting and I hadn't even paid attention. They're paying attention in Texas, in this part, in that part of the country. And then, of course, who can keep up with the Kardashians? If that doesn't stress you out, I don't know what will stress you out. Those good-looking people living this fabulous life, that pisses me off. I need to go and get a drink and a pill to deal with that. So putting it all together, addressing social determinant of health and aiming for optimal social welfare and population well-being. So there were a group of individuals that got together and did some work and did a sort of an in-depth study about the health system, and their conclusion, which I found very interesting, is that recommendations are about policy, so strengthen assessment and action on health impacting social policies, expand policies that increase resources and environments fostering healthy behaviors, extend the reach and transform the financings of healthcare services. This is not to say that we do not need more clinicians and that we don't need more basic science research. This is not to say that. This is to say we need more involvement in the policy world and trying to change policies, trying to change that landscape. In addition, I know you, especially physicians, nurses, you worked so hard already and volunteered so much of your time and you're involved in so many things. And here I am saying we need more of your energy, of your smarts to help us with change policies. This is another report also by a group working under the National Academy of Medicine that talked about advancing social determinants of well-being versus health. Does not have the automatic association with hospitals, clinics, visits, tests, procedures, and medication that the term health has. And this is the new part for me. This is I didn't know this conversation was occurring, and there's quite a bit of that, and I find it fascinating. Again, can we talk about engaging others and avoid medicalizing the medicalizing health, I suppose, to talk about well-being in all policies rather than health in all policies. And it's taken me a while to comprehend that, but I think it has a profound way of looking at the world and aiming towards well-being. Again, certainly we do need efforts to be increased in proper regulation and availability of distribution of drugs, big use of big data that was discussed earlier, and actually some of my presentation here was influenced by the Chapter 55 report that I read. It's an incredible, thorough report. Adequate health insurance, coverage for multimodal treatments, not just to pay for drugs. Education, as we've saw earlier, this institution is incredible at doing that. I wish I had been educated at a place like that. This is a framework that it's totally, you're not going to be able to read it, but I was part of a panel of the National Academy of Science and Engineering and Medicine where we talked about the interprofessional education and why, for health professionals, and why I have it here is, I think, is this a cursor? Yeah, this is a cursor. The community aspect was a central aspect, and the items in there are community engagement, engaging with communities in a reciprocal manner where dialogue is back and forth, it's not just top down. And that was not a room full of social workers. I was the only social worker in that room, and that was the consensus of the need for community engagement at a really deep level. And I think the CTSI here does that work, and other institutions are doing that work, so it's very promising. or the organizational level, all the put in more efforts into social determinant of health education, and I think this institution is impressive at doing that, and I think we should continue doing that, and encourage other institutions to continue focusing on social determinants of health. And training, professional training. Increasingly, we see more social workers being trained jointly with doctors, with nurses, with other health professionals. The more we do that, the better we're going to be able to serve our communities and our clients. Again, increased prevention treatment efforts. Understand, this was also discussed earlier, understand the needs of different populations as the epidemic impacts populations differently. And it's, you know, I go to a baseball game, I go to a football game, I'm talking to someone next to me and they find out I do substance abuse research, and they look and they hear me speak with an accent, they look at my skin, and they immediately, they feel compelled to say, this epidemic affects everybody equally. As if I was ready to say, stand up and say, we are the most affected people, we're the worst off. I wasn't going to do that, we're just having a conversation, but people do that, and white people are affected just as much. I'm like, no, okay, relax, we are all affected. Okay, they feel better. And inside I'm thinking, not equally, but I don't say that. I want to enjoy the game. And it is, everyone is impacted. But not everyone is impacted equally, right? And the more we can know what that difference is, the better we can tailor our interventions, our communications, our partnerships. And how do we know that? I mean, I look at all these different groups. I'm not that smart to learn about what all of them are about and what everyone nuisance treatment or intervention should be. So this is where I was referring to earlier, how my work with Native Hawaiians, with African American populations, American Indian populations, I was taught, well, I don't need to know. They can teach me. They can tell me. They know that. There's things they don't know because many individuals haven't had a benefit of a college education, but they know about themselves. And they can tell me when I go into their communities, if I ask. And this is not even, one might make an assumption, well, you're a social worker, that's what you were trained to do. Not entirely. It's taken me time, it's taken me working, going back to these communities and working with them and saying, I don't know what you're going through, tell me. And, well, we need this, we need that. And it's been a fabulous learning experience. Partner with law enforcement, definitely. Include social worker in your team. This is a public service announcement, really. This has nothing to do. And not that you do, but let's not sit on the sideline. Let's work towards enacting policy. Don't stop marching. Million March, Black Lives Matters March, Women's March, March for Our Lives, March for Science. We cannot stop. Thank you, I have 2 minutes. Good thing you're doing it in front of the person, not behind somebody, then it look funny. Partner with communities to continue working towards offering universal health care. I know it's not going to happen, single payer is not going to happen, but if we aim really far that way, maybe we'll get a little closer and better than what we currently have. Make housing and education more affordable and eliminate hunger and food insecurity. Support family leave programs, employment benefits. I know, you're thinking, come on, I'm a clinician, I'm a doctor, I'm a nurse, I'm a social worker in this age. Why are you telling me all this stuff? Because this is all the other stuff that's outside that I think if we neglect, we then, within our environments that we practice our professions, we end up with this sort of crisis or our inability to properly help, especially the most vulnerable communities. And I want to end with this quote from Opioid Epidemic, but it was about people being, vulnerable individuals being impacted and injustice. And I think the idea that we're all connected and things are connected, and I know one of the first lessons in Epi or stats class or math class is just because the butterfly flap its wings in another continent, there's a hurricane occurring in Florida. You know, just because things are correlated and not causally related, and we know that. And I'm not making that point, but I'm saying this constant bombardment of negativity worldwide, something we might not be able to control, others we can through hopefully the interventions I described, the marching, the working with your policymakers, the educating of students in a different way than we traditionally educated. I think that can make a difference. That can change things. And I'll stop there. Thank you.
Thank you. Take one question.
Sorry, I got you all depressed now.
No.
Let's go drinking together.
It's ready for the break. Okay. Excuse me. So we'll reconvene at the top of the hour, sharp, and we'll move on to the scientific portion of our presentation. Thank you.